everyone. I think that um, that will be my second attempt to make the live stream in LinkedIn, and I don't know why, but the guts of LinkedIn is definitely not on my side. So it was planned today to make the event under the link that I have shared, but somehow it's not working. So let us just go in this format. And I think that anyway, it will be informative for you if you're working in the healthcare area. Then the information that we will be discussing today will be informative and beneficial for you. And we have today a very interesting topic about the rise of the healthy patient and how exactly the clinical care models should be written in regard to this new trend. And I think that it's a kind of the very important topic because a lot of the medical organizations, they still thinking in the old school manner about the interest of the patient and about the possibility to fulfill this interest. But we see already that it's not available with the current workload on the doctors and on the medical staff. And exactly in this regard, AI have the biggest possibility to help and to deliver the needed quality of the care with a good probability of the satisfaction of the needs from the patient side. So let us start with this. For those who have joined spontaneously this live stream and have never ever worked with me, I'm Anna Solovyova. I'm the managing director of Visual Medica, and I'm working more than 10 years in the medical AI field. And I usually make in one or two times per month a kind of the interactive session where we're talking about the innovation, particularly in the field of AI in the healthcare industry. And I'm sharing some examples from the real world cases and the results from the organizations with whom I directly working on, or the organizations that sharing their results online in the terms of AI implementation, not only as the research results from AI, but also the business results and the actual results in the different economical values that that are the more important for the clinics. So let us start with this. So as I said, we have a quite interesting and important topic today, and we will discuss it from the different sides. First of all, from the sides of shifting to proactive care, what it is and why it's important. Then, of course, we will discuss a real-world impact on the governance and how exactly the clinics who are applying this new shift and applying AI for this new shift, how they work with this. Then, of course, we will talk about the seamless workflow integration for proactive care. Of course, we will discuss, as usually, the return on investment and the business case definition, because at the end of the day, it's good to have something innovative, something that sounds very trendy, but we understand that for the clinics, at the end of the day, it's also the part of their business results, and we need to define when we're thinking about AI and the implementation of any kind of AI tool, we need to think what we expect in the different levels from this AI tool. And of course, clear definition of the ROI in this regard is very important. And then, of course, we will discuss how to prepare for healthy patient AI strategy in your clinics if you will decide to go in this direction, what you should think beforehand, and how to plan the AI rollout in this regard. So let us start with this. So if we will talk about the trend and the situation that is happening right now, so it's really very similar to the shift in sense. And a lot of the organization, as I said at the beginning of my talk, a lot of the organization, they're still thinking in the terms of the patients, in the terms of the services that they are providing more as the reactive way of operational business. So previously, the majority of the patients who have came to the doctors, they already have some symptoms and they came to get some kind of the treatment, and there was some existing conditions, and everything was around the treating the patients with the symptoms or identifying the correct root cause of the symptoms, and then of course developing the treatment schema around of these findings. And the thing is that still we have, of course, a lot of the people who are coming with the same problems, but there are also emergent trend that is connected somehow with the new needs and with the new wellness trends that are arriving in this area. And this trend is called healthy patient. Yep. So the healthy patient is so-called patient, or it's even not the patient. It's more in the terms like the customer who's coming in your clinics with a request for the preventive cares. So the healthy patients, that the people who currently have no symptoms, but because they want to be proactive about their health, they want to act before any kind of the symptoms will arise, before any kind of the problems will arise, or they might also, in this category, we might also put the patients who are coming with the very early symptoms without some acute case. And as I said, there are a few trends that is happening right now in the market that lead to this interest to the healthy patient area. And the first trend is, of course, we see a lot of the bloggers, we see a lot of the public persons right now talking about longevity, talking about some kind of the proactive healthcare, and people try to follow this trend, and they also try to be very proactive, and they want to know exactly how to preserve their health, even from we are not talking in this healthy population, the people who's after the 50, mainly that's the people 30, 40 years old who is coming, as I said, without some concrete symptoms, but want to understand how to preserve their health, and which kind of the wellness technology, which kind of the approaches might be useful for them, so how they can track their health consistently. And they have a few of the very concrete distinguish in this group. So they are very informed about the healthcare trend. As I said, they follow the bloggers, they read some articles. Here exactly comes the question, how credible are the sources that they use? And if they are like overhyped with these trends, if they have some kind of the information that can put some fears on top of that. But anyway, they're reading a lot and they understand already a lot about their health. And they come in with this information. So they come in from, as I said, from the different kind of the request. If you will compare it to the previous group of the patients already with the symptoms of the patient, then come in and just saying that they have some pain in, for example, in some part of the body, and then the doctor needs to understand the root cause. But these healthy patients, they come in with the questions in the other area, like I have read about that, and I want to understand how exactly I should apply it to my health. Is it my case or it's not my case? And which tools or maybe which kind of interventions you can arrange for me. And these people, healthy patients, they usually very data driven. So they very a lot of the wearables. They very good. They're familiar with the kind of the data that is tracked by their wearables, and also they might be somehow manipulated by this data. So if you have the Apple Watch or you have any kind of the other wearable devices on you, usually have a lot of the a lot of the signals about your heart rate, about some kind of the changes in your stress level, your oxygen level, and so on. And this information somehow might also affect the person to think about their health. So if any kind of the trend is changing and this information is shown to the person, then of course the person can have fear that something is happening inside. And then the person will come with this information to the doctor. And of course, these kind of the patients, these healthy patients, they're very collaborative. So they are looking for the doctor not just for one intervention, as in the other group with the symptoms, when you have the acute symptoms and you just want to have some treatment to elevate any kind of the problems. In compared to this group, the healthy patient, they come in for a long relationship with the doctor, and they want to have someone who is helping them to build this practice strategy. So it's not just like, simultaneously 1, 2 times to come to the office, but really to have the doctor, to have the medical organization, which I trust, and where I can come some kind of the information that will make me healthy, will make me more understandable about what is happening around my body. And I want to have someone who can continuously support me. And of course, this shift to the healthy patient population also puts some kind of the additional stress or additional consideration on the doctor's shoulders. So, first of all, the consultation focus is changing. As I said, this patient come in already with some information, and they come in with a different kind of their request. And they usually also requires more time to like to speak with them and to chat and really to understand what is happening with them and why they came for the doctor. So they're looking for some insight. And they in this regard, talking with this patient, the doctor need also to have the good level of the data literacy, because if the patient come in with some information from the wearables, with some data, with some trends, then of course the doctor need to take a look and understand what is happening. And the format of this data might be very different. Even if we're talking about the cardiovascular health, there are a lot of the different biomarkers or the indexes that is tracked by the wearables, and even the technical area sometimes like trying to format or trying to normalize these indications between the different wearables might be very difficult. So for the doctor, when speaking with this healthy patient who's coming for the practice health, it's very important to understand all this data. And then, of course, evolving patient expectation, as I said, that's the long story, and the patient want to be sure that it's not just the treatment plan, but it's really like the personalized care plan, the personalized health journey that is supported by these doctors. Information overload, this is the same situation for the patients, but also for the doctors, because if the patient looking for some information and spontaneously having some kind of the scientific articles, reading them, maybe getting some information on the topic that might be interesting. That's one case. But for the doctor who's trying to get right now in this preventive care even more, it's very important to have a constant update on the literature research, on the trends that is happening right now. And so you need to be data you need to have a good data literacy, but you also need to stay up to date with everything that is happening in this area. And it means that the information that you as the doctor need to consume is doubling, and sometimes even more, like in this progression. And it of course creates this information overload, and somehow it's need to be developed like the additional tools that help you to digest the immediate information, to select the information that has the more credibility, and so on. And then, of course, maintaining the human connection, as I said, for the patients who come in for the practice health, it's very important to build the trust, to build their relationship more than just one visit. And that requires time, and that requires additional, like, as more as it possible to free up the time for the human interaction, and then of course to put some tools in hands of the doctors, at least to make this data assessment as quick as possible with AI or anything else. So there's different type of the proactive health management tools that is available right now. We will just discuss very briefly about everything that is possible. So as I said, AI plays the crucial role when we're talking about the proactive healthcare management, basically because of the vast majority of the data that need to be processed and need to be detected as the patterns inside this data. So if you're talking about the AI, where it has the big potential is the possibility to digest the data from the electronic health records, genomic information, lifestyle data, and any kind of the data that captured through the wearables, plus the social information about the person from the questionnaire or from any other source. And when we put all this data together, then we have a big potential um, to predict with a good probability in which category this person should be put into. According, for example, to the risk of some diseases, according to the risk of elevation of some symptoms, and so on. So that's very important. If we're talking, for example, with the cardiovascular events, we have the information about the patient history, we have the information about the family history of this person, plus we might have some information from the social way of living this person and the data from the wearables. Having all this information, we can predict the possibility of development, some kind of the cardiovascular rest in this person, for example, in the nearest term. And then that's the first step for us to understand how to go with this person. So it's like the very early prediction, as I said, when the person has no developed symptoms at this moment, but really want to have the proactive care. At least we can select the people who has the higher probability of the disease development versus the people who have the lower probability. And then, of course, at the next steps, we can identify the right care for the right person at the right time. For this, the big help, of course, is the wearables and the data that we have in the wearables. So as soon as we identify that the person is in the risk group, then, of course, we can together with the help of AI to find the tailored intervention for the specific risk profiles and unique characteristics. So that's exactly the information about that's exactly the next step in this information gathering process. So if we know that the patient is in the risk group, then we can understand what exactly can minimize the possibility of development of acute cases in this person. So if our patient has the high risk of development of the diabetes, then together with the wearable devices like the device that can help us to measure the glucose in the blood of the patient, we can already understand which of the diet, which of the lifestyle intervention can be the most helpful for this patient. So it's like the continuous process. And we starting from just identify the risk group, then we identify the possible kind of the intervention or the lifestyle management that might be the most applicable for this person. And then, of course, we can use AI and we can use the data also from the wearables or any kind of the other system that can provide the stream of the data for us. We can monitor consistently if we see any kind of the degradation in the performance, if we see any kind of the acute patterns in the data, to react very quickly to these changes in the data. Yep. So if we know that the person has a probability of the cardiovascular risk disease, we have proposed this person the more healthy diet, less cholesterol in the diet, and maybe then we can also propose some kind of the activity changes. And on the next steps, we understand that right now in this person we see the quick change in the patterns in the heart rate, for example. Then, of course, we can prevent this acute case, and we might notify the person. We can contact the person about the need to come to the office of the doctor right now, and potentially, of course, prevent the very bad outcome for the patient. And the next thing, when we have everything in place, is of course development a kind of the insight and the coaching system for the person. So what you see right now on the screen, I think that majority of you using the same system in your Apple operational system. Maybe if you have Samsung, if you have any other wearables, if you have any other smartphone, you might have almost the similar platform, almost the similar kind of the application where you can track your data, any kind of the technical provider, any kind of the mobile development company right now going in this direction, trying to capture the health. That's why I'm sure that any kind of the mobile phone that you have almost the same possibility to track, of course, with some deviation in the precision, in some deviation in the indicators that can be tracked. But anyway, what you see is the health, Apple Health visual interface. And what is very important that because this interface can capture a lot in this program, you can capture a lot of the data. The interface show you exactly how your changes in the activity level, how your changes in the diet, and how you might be changes in the stress affect your overall health. So you have a kind of the coach that can say, okay, this week it was good. your stress level was a little bit decreased in compared to the previous weeks. Your heart rate was this one, and you have made so many steps. So that's why we see that your health trend developing in the good side. Yep, so development with some potential for the health improvement. That's very important because you cannot have your patients with you 24/7, but if you have the system like that that continuously monitor and understand, first of all, if the patient is in the risk group, so which exactly risk group is this patient adherent to? That's the first step. Then you understand that within this risk group, this patient can be also coached and can be also proposed with the potential kind of the intervention. That's the second step. And then you can monitor in the real time the changes in the data, and you can do it everything, not having the patient sitting in your office, but you can do it just on the remote basis. Then, of course, having the AI system that can capture everything of this and just notify the doctor with the acute cases or with the kind of the signals that is very important to be handled in the doctor's office, then of course that's the great win, and that exactly creates the sense of the proactive healthcare and the sense of very close communication between the patient and the doctor, or the patient and the medical physician. Because as the patient feel that my health is good, like 360 on all the sides, I understand and I'm informed about any kind of the potential predisposition that I have. I'm also constantly checked, and my data is checked for any kind of the deviations in the patterns in my health. And also, I know that I can have some kind of the tailored coaching account according to my data. So each time my data is changing, then the system proposes me something, and I know that in the acute cases, my doctor will be also informed, and then someone will take care of me. Maybe medical staff will inform me that I need to come to the office. That's exactly, this is the concept of the healthy patient. And we will go right now a little bit further on, discussing, of course, how it can be, this kind of the early intervention can be assessed from the medical side. But it's very important, before we will jump there, just to underline that this is the critical need for the healthy patient that is coming right now. A lot of the people, they seek the same advice right now in the technical tools. There are plenty of the mobile application that try to follow up the health trends, that give some prediction about the diet that is needed for this person, the activity level, and so on. But the problem is that usually it's like stored in the different places. The data is not interconnected. There's the missing piece of the data is this data from the electronic health records. And of course, the problem for a lot of this application that it's not guided by the medical personnel. Yep. So I can download this application, but I don't have any kind of my private doctor standing behind this application. So I don't understand what I need to do in the critical cases. And also, I don't trust the application, the critical cases that it will handle if something acute will arise. With this, let us talk slightly about, as I promised, the medical results, just to show that how exactly the system functioning, and how which kind of the wins can be gathered if your medical organization will decide to empower or to add AI powered tools to the healthy patients. So we'll have a few examples. Some of them are based for the population that have already some signs of the disease. The other one might be fully applied just for the healthy population. The most important is just to understand the correlation and to think how exactly it can be implemented in your practice according to the amount of the healthy patient or the patients with the early signs that is coming to you. So the first example that we will take a look on is the AI-powered diabetes management platform. I think that also all of you have already seen a lot of the marketing and the advertisement about the glucometers that you just put on your hand. And that can count the glucose in your blood after usually after some kind of the meal intake. And as usual, it started with a kind of the tool that is developed just for the people already with the chronic disease, meaning with the diabetes. But the healthy population came to this tool also quite quickly, understanding all the potential wins that can be inside tools. And if you will take a look right now, a lot of the bloggers, a lot of the public persons, they used the same glucometer without any previous history of the diabetes, just to measure the glucose in the blood after the meal intake. So some they started just for the chronic disease, shifted to the healthy population. But if you talk about the people who have already some signs of the diabetes, having this glucometer on your head and having the AI platform that analyze the data all the time, so you don't need to write up everything is previously like in the piece of paper and then discuss with the doctor. You have insight just on the tip of your fingers because it's already in your phone, for example, on your tablet. It has stated that the people who using this kind of the tools, they have they are more prone for the weight loss, and they are more prone to keep the healthy diet. We can see also in the screen that the mean for the IgB A1C reduction was minus 0.32% at 24 weeks. So the people continuously, when they see their data continuously, it's a very strong psychological effect. They understand how exactly any kind of the intervention with their health as the meal intake, for example, or the continuous rise of the stress level, how exactly these intervention affect their health. And seeing this data, they are more prone to keep their healthy habits that they try to develop. And that's the same for the population that have already some symptoms, and for the population that seek the preventive care. That's the very important time that you need to take care of and thinking if you have the request for a healthy patient in your clinics. Another also very informative and the very visual use case was in the area of AI for the early detection of the diabetes retinopathy. It showed that the people who was proposed to use AI for this kind of the disease recognition during the standard exam, then, 100% of the participants completed their diabetic eye exam within 6 months, compared to just 22% in the control group. And among these who has completed, 64% in the AI group completed specialized follow-up versus 22 in the control group. It means that when you have the tool like AI that helps to make the process of the examination quite easy for the patient, it takes less time, and the doctor, of course, can take more patients during the day because you have the help from AI to detect any kind of the deviation in the retina of the patient. Then, of course, the patients are more prone to make this visit and then to come for the follow-up visit, because everything is simple, because you understand that it's taken less time than is usually. And it's also interesting because you see kind of the novel technology working together with the doctor. So if you have also any kind of the if you have any kind of the problem with the rising amount of the healthy population that is coming for some kind of the interaction, for some kind of the checkups, adding AI as the tool to help the doctor might be of a great beneficial for your medical organization, because you build at the same time the trust with the population, you build the interest in the population for coming for the checkups, but also, of course, you help in your medical doctors because they have the second brain or the second almost a person, AI person, who can come and help with the assessment from their patients. Then, of course, there are a lot of the information about the reduced hospital readmissions. So one of the cases, and the examination for these cases was done in the Mayo Clinic Health System Regional Hospital in Wisconsin, and they have implemented AI-based clinical decision support tool directly in the care workflow. And then the idea was to assess if having this AI decision support tool can lower the readmission for the patient in this clinic. And it was stated that really it was the readmission dropped from 11.4 to 8.1% in the 30-day readmission, and in totally, after adjusting for changes and at control hospitals, they have relatively reduction of 25% in readmission. Why this decrease in the readmission happened? Basically because AI helped to identify the high-risk patients and to tell the medication and the treatment process for these patients. And of course, because the AI system was directly integrated in the workflow, so it was easy for the doctors to use the system. And it's like you don't need to make additional moves, as usually it's happening with AI tools. And in the medical area, where you have the additional tool that you need to switch on, and then you have the EHR data, and then you have AI tool, and it's difficult to use it. But when you have the signals for the doctor directly into the workflow, that's integrating like easy and understandable for the doctors. And with this AI decision support tool, you can flag that the most risky patients to pay attention for them. That's the very good help for the doctors. So the doctors who are using these tools were more easy to use this tool. At the end of the day, it has decreased the amount of the readmission cases in the clinics, and because it was like multidisciplinary type approach, so of course it was interesting from the lot of the sites, and the team has used AI insights to prioritize resources and to coordinate patient-centered intervention, focusing efforts where they were most likely to prevent readmission. Yep, so it was like the collaborative work where we have AI, where we have the doctors, and the most important component, I underline one more time, is the ease of the usage in this case. Because if you implement the same system, but within the common workflow for the doctors, that definitely won't finalize any kind of the good results. Doctors either will not use the system because they don't have additional time, they will forget about the system, or at the end of the day, they won't trust the system a lot. And another quite similar case also about the reduced hospital readmission was made in the Zuckerberg San Francisco General Hospital. And they have showed that using AI system for monitoring the health data of the patient using the HR data, and they employ this predictive AI algorithm to identify high-risk patients. Then they have showed that readmission has dropped from 27.9% to 23.9% between 2015 and 2023. And of course, if we will calculate like as usually from the business case in the money scenario, in the money equivalent, then of course it was about $7.2 million at risk pay for the performance funding. So that's also the possibility if you have either the healthy population or you have the population with some kind of the readmission risk. This kind of AI tools can be a big help for you. If we're talking about the healthy population, as I said at the beginning of the presentation, if you can categorize the person without the acute symptoms in one of the risk area, and then you can follow up and you can early catch the trend that any kind of the data is changing, for example, with the cardiovascular health, then of course you can make some preventive measurements not to, for the person not to develop the acute case and then come to your clinics and then of course stay in your clinics with the potential readmission later on. So think about AI here is the possibility to, first of all, to stay highly connected with the patient, with a healthy patient, but also the possibility to predict the risk of developing the acute cases and those to decrease the workload on your medical staff. And then also one interesting one interesting use case for AI in this area might be the medication AI tool, or any kind of the pill dispenser that have a sensor that has a sensor and can continuously monitor how people taking some medication. If we're talking about the healthy population, and as we talked previously, we have categorized the patient in one of the risk groups, and we want to take some preventive care that also connected with the preventive medication. Then, of course, it's very important for us, for the medical staff, to understand exactly how precise the patient is going with the medication intake. How it's happening right now? Doctors, you come into the doctor's visit, or the patient coming to you, and then you're asking the patient about the medication intake that was prescribed previously, and then of course the patient will say, yes, I have made everything as you have asked, but I have some new symptoms, or I don't know, I have more acute case right now. And here exactly, we cannot, previously there was no possibility somehow check the correctness of the words, the truthfulness of the patients. But with the development of this AI pill dispensers, it's more available. So especially for the population who have some kind of the predisposition for the diseases, we can track how the person is going with the medication intake. We can understand if there are any gaps, and potentially if the person stopped taking the medication, it can trigger, the AI can analyze the data and trigger the doctor to communicate with the patient and ask about the reason why the medication was stopped. And also it gives a good data and a good trend on the data that the doctor can look into before talking with the patient, to understand exactly if the medication intake was the correct, and if everything was done in time, and then of course to plan the further treatment intervention based on this data. Yep, and of course there are a huge possibility and the probability of using AI in this field, but as usually we have a few why it's not working and why sometimes it's so difficult. And I want just also slightly talk about this. First of all, the AI, we have already talked about it on the previous meetings. The thing is that AI need to be explained. Yep, and the explainability is the main focus and the main request. If we're talking about the healthcare AI, the problem that a lot of the healthcare startups, a lot of the research projects, they aiming to show the full potential of AI, the full potential of novel approaches in AI in the healthcare, but unfortunately they're not explainable. Even if we're talking about the large language model that is like highly known right now thanks to the ChatGPT. This approach is good when you want to write the article, but it's too costly to unbox this way or this kind of the prediction system. Yep, that's why you can ask ChatGPT about some diagnosis, but to unbox it and fully understand all the interconnection between the different pieces that has led to this answer is almost impossible. So that's why thinking about this one more time, I underline is usually thinking about the more easy approach is something that you can do with the less investment on one side, but with more proven track record, with more proven result that can be unboxed later on. Then, of course, the focus on the actionable results. Yep. So the thing is that if you have the system that provides too many signals for the doctor, then if analyzing the situation, the doctor just will switch off the alarm on this tool, and it won't be useful at all. On the other hand, too little signals can also be harmful, because we can lose some momentum that is very important for the patient, for the healthy patient, not to develop the acute state. So there should be a very good balance, and should be discussed, and should be, of course, developed according to the medical guidelines and the needs of the doctors. The same by the way we have for the patients. So we have, as I said, too many signals. If the signals are not understandable for the people, as it's usually happening, by the way, right now with the wearables. So the wearables give you some trend in the data that your heart rate has elevated, something like that, within this period of time. Usually, it doesn't give you any information of what to do next and how critical it be, because it's already in the medical field. And I remember I told you that technical companies, they don't have doctors standing behind of this. That's why they cannot be used as the diagnostic tools, and they just can discuss it with it as the trend, but give no information for the user. So when developing the system like this, you need to be sure that the patient will have all the information that is needed. You won't develop the feel of fear, but you will develop the fear of trust between you, like the medical organization, and the patient. It's very important, and sometimes it's lacking. That's why developing the system that like overwhelming with the signals the doctors, or even some kind of the scary or informative signals for the patients, won't be at the end of the day useful, and you will just invest money with no return at all. Then, of course, the biases that is happening, we have also talked about it in my previous webinars. It's still happening, and you need to understand and first of all, assessing how many healthy patients you have, for whom you're developing the system, what is needed, the diversity of this patient, the diversity of the questions that are coming for you. And then, of course, to develop the system that will be good balancing the biases. I think that you already understand what bias is in the AI. But like in generally, it's the different groups of the patients, it's the different requests that they come in for you. All of this should be included in AI system to be reasonable and to be effective for the patients. The same biases in regard to the doctors, in regard to the signals and so on. It should be assessed, and when thinking about applying AI in your organization for the healthy population, you should take care and, as the first step, of course, assess how diverse data you can use and how you will go with that. And then, of course, the governance frameworks. I know that if you're working on the executive position in the medical organization, that's exactly the people with whom I'm talking the most, and not this problem of the accountability, responsibility, and ongoing support of this system. All of this is critical, important, and of course, before you will jump into this area, before you will decide that you want to apply AI for the healthy population inside your clinic, you need to understand how this process will be organized, who will take care of that, who will be responsible for the deployment of the AI system, who will be responsible for the ongoing evaluation, the audit of the system, because the systems, AI systems, carry one more time, they degrade the performance with the time. So you need someone who will control it. And at the end of the day, you need to understand how you will assess the effectiveness of the system, either for the doctors, but also for the patients. How you go with that. So you need to have the clear plan, and you need to allocate additional resources for this. A few additional cases of the AI that can be used. AI, for example, as the clinical workflow enhancer for practice health. There's a lot of the cases where AI might be in the great benefit for the doctors, but also for the patients, like AI that flagging the opportunities for the preventive screening. So each of the patient should be maybe update about the preventive screening for the early cancer detection, for the cardiovascular risk assessment. So if you have the tool like EITEL that can assess a big amount of the data, from medical data, the data that's connected with the social economical information about the person, you can assess all of this. You can put the person one of the back about the critical or the criticality of the development of the disease in this person. Then, of course, as the next step, you can sign up additional preventive screening for this person. And then, of course, AI that's suggesting personalized lifestyle recommendation. If we know that the patient also has some risk of the development of the diseases, and the person is coming for you right now healthy but wanted to take the proactive care, then of course with the help of AI analyzing all this data, you can understand which kind of the diet and which kind of the activity will be the most tailored for this patient. So we're talking here about the very deep personalization, which were previously not available, like we had some kind of the diet that should be described for or prescribed for the patients with this kind of the disease, but it was not personalized. Right now, with the help of AI, we can build additional personalization on top of the preferences. If we're talking about diet, what exactly the person likes to eat, doesn't like, in which country the person live, and what are the season right now. So we can make it really personalized and really tell it to the request of the patient. And then, of course, AI-driven risk stratification for early intervention. When the patient already have some kind of the early non-specific symptoms, then, of course, AI could analyze this longitudinal data in the EHR to provide a risk score for developing a more serious condition. Yep. And then, of course, if we have the high risk score and we see that this person has really some early signs, then we can take some corrective measurements not to develop for the person, not to develop the acute case. Then, of course, it can be AI-assisted population health outreach. Yep, so the cohorts of the data that might have some kind of the predisposition of the diseases. Previously, for example, we had the cohorts like the mammogram should be prescribed for the women after 40s, and it was like standard patient outreach or the standard portion of the women who's gone for the screening. Right now, we can make it more tailored. Maybe for some women, it should be prescribed a little bit earlier because of the family history and so on. So, as I said, AI can digest this data, can make more personalized prediction. And of course, personalized wellness plans, but it can be applied both for the healthy patients, but also with the patients with some symptoms to understand exactly how more specific intervention can result in the better healthcare outcomes. And then, of course, intelligent alerts and precision. Yep, so early warning signs. AI can help clinics and the clinicians to predict the acute cases for the patients who have already some kind of the disease history, maybe right now with less symptoms, but really to understand what are the status, what are the correlation of the data that need to bring the alarm, or need to bring some kind of the trigger for the doctor to take a closer look to the data, or maybe, as I said, contact the person and invite the person to come into the clinic. Just also a few words about the AI-driven tools, like the concrete examples. Also, you might heard about the Omada Health, Noom, Fitbit Coach. A lot of them working as AI-powered virtual health assistants. Currently, these tools, as I said, they're more like the wellness area. So here, just for you to understand the possibility of the development in the healthcare field, but that's the wellness. The wellness, they are more wellness because they don't have the access to your electronic health records. Yep. So usually they act as the questionnaire that you fill data into, and they don't ask a lot about the disease data. It's mainly like the data about your lifestyle and about some preferences. But anyway, even having this kind of the system more for the weight or more for the wellness, it has stated that the systems, the coaches like this, as we talked previously, has a very good benefit for the development of the healthy habits of the patient. So you can take this concept, think about it, implement it in your healthcare organization, but of course, not just as the kind of the wellness, but really 360 healthcare programs. Why it's working and why people liking it, as I said, that's the talent guidelines. So you have assistant, you have the coach who's with you and who gives the recommendation basically for you based on your health assessment, not because it was good for some kind of the cohort of the people in the research, but it's good because it's based on your data. And then, of course, adaptive feedback, like you can do it in the real time. If you right now have the diet and you prescribe this diet, but you don't have ingredients and you don't want to go outside, you can just ask additionally, and then the data or the prediction recommendations for you will be reassessed in the real time. And the most important, it's available 24/7. So it's like, it's almost like your doctor, but in your pocket. And each time you can come up, they also make in some kind of the interactive AI assistant where you just can even pull the questions that you have. And it's like, when you have the system like that in your medical organization, it's not just wellness, but for the health, it's really the needed level of the connection between the patient with a healthy patient in the organization without additional distraction for the doctor. So you have all the time, you have the coverage on all your questions, you have the good plan, you have, of course, they implement gamification, which of course is very important. It's up to you decide if you want to have the gamification, something like that in your organization. But beside of this support, you also have some kind of the points that promotes your healthy habits. Yep, something that rewards all of your healthy choices. And of course, for me as the patient, if I see the trends in my data, I see how they improve. I see the support, and then I see that I have this availability to be supported from all the time. That's very important. And also important thing that is safe space, because some of the situations when we feel ourselves a little bit uncomfortable to talk with a doctor, but still we want to share this data. It's very important to have this possibility to chat. Here, of course, the question, either your system want to gather this data and then also to share it with the doctor, or it will be completely private and not shared with the doctor. It's up to you to decide, but it's very important that a lot of the studies show that people, they feel more comfortable sharing the sensitive questions with the AI systems. Of course, with the limitation, like the answers, how deep AI can go in some kind of the diagnosis and some kind of the differential diagnosis support for the patients. But anyway, it's very important that the patients, they feel more safe when talking with these AI agents. Then, of course, that's more like the sci-fi, but anyway, a very trendy thing happening in the pharma. Might be also interesting to think about it in your medical organization if you want. The working AI solution is the digital twins. The digital twin is the concept when we gather a lot of the data, the health data, the health records of the patient in one place. And then if the patient has any kind of the early signs of the disease, we can try to model the development of the possible disease, to which disease that the person has the predisposition to. And then, of course, we can also play with a highly personalized risk assessment and play with even sometimes with the personalized treatment programs. Yep. So, of course, it's improved patient outcomes, because if we know we have the risk of the disease, we have the early signs, we can, with this digital twin, play and try to model the disease development that's more visible for the patient to understand what might happen with my body, what are the main critical symptoms that I should react to, what are the situations when I should come to the doctor's office. And if we need to find the treatment program, then of course with this digital twin, it might be also, first of all, interactive for the patient to understand how exactly the treatment will affect the body, how it will help my body to recover. But also it's very important because there are plenty of the different medication that can be applied in this particular case. But if we will model, if we will see exactly how the trend and how the health indicators changing when applying the different kind of the medication for the person, then we might be more precise in finding the best treatment strategy for this patient. Then, of course, AI-driven tools for the health, and AI-driven tools to leverage data and provide any kind of the real-time analytical monitoring of the data. There are a lot of the startups, a lot of the mid and sometimes even big companies working on that. There's the application that allows in the real time as the help for the doctor, but also for the patient. For example, we're talking in the field of the laboratory medicine, to assess the laboratory results, to provide the comprehensive information about what is happening inside the biomarkers without the additional workload for the doctor. So if I was the healthy patient coming with some request to make the checkup, the blood checkup, then I have the results from this blood checkup. So maybe instead of going to the doctor and taking some time from the doctor one more time, maybe I can have a tool that can analyze this data and provide me with some information, and only trigger the cases for me and for my doctor, the case where the doctor need to meet me and to discuss some acute cases. So that's also the very big thing that is important, as I said, psychologically for me, is for the patient, but also for the doctor. And then, of course, there are plenty also different possibilities applying the AI assessment tools, AI screening tools for the healthy population, because more and more people, as I said, come in for the preventive screening. So there's AI-enhanced ECG monitors, there's AI-powered mammography and cancer screening tools, and of course, the radiology and the lung disease screening. All of this is available, and because the trend, as I said at the beginning, the trend is rising for the healthy population to come for the preventive care. It means that with the time, your doctors might have even more workload in the screening, in this preventive conversation with the doctors. As much as you can help, at least to separate the healthy population from the population that need to be taken care of with the doctors, so like the second look or some kind of the predisposition, some kind of the disease already visible on the image where the doctor need to look. As much as you can have this help for the doctor, the more successful and both in the medical, but also in the economical terms, the medical organization will be. And here's just the few points of showing the business results. Just also to understand that it's not the hype, but it can bring some meaningful results, and also thinking for you in the future how you can implement the same. Mainly, if we're talking about the case of the mammography AI tool that was applied in the South Korea, one of the hospitals, they have showed that the cancer detection rate increases. So more patients at the end of the day were detected with the early signs of the cancer. And then, of course, they improved outcomes and reduced late-stage treatment costs. Yep. So if if your medical organization work on the business model that is connected with the treatment cost, and you want to decrease this numbers, or either the same for the cancer, you want to decrease the readmission or the length of staying of the patient inside your hospital, then you might think about the tool like this as the early prevention or the early treatment possibility. The same, of course, for the ultrasound, for early diagnosis also. In the University of Rochester Medical Center, it was shown that, of course, having AI plus doctor, so it's very important. One more time, we are not replacing the doctors with AI, but really we just enhance them. Then, of course, it has shown that it has more positive impact for the at-risk patients, and it gives more possibility, as I said, at the end of the day for the doctor to concentrate on the cases that really requires human touch and that cannot handle just with AI. For the medical stuff, we have already talked a lot, and I think that you understand, like on this picture, we have on the slide, we have two pictures. One is the old lady waiting for the doctor to come already in the acute treatment area. And the doctor on the other picture is just sitting and talking with the woman who has a headache, and potentially the young woman who wants to take a proactive care of their health. Yep. And because the doctors has this overload, and the doctors need to separate their time and effort between these two groups of people, as much as we can help doctors to spend less time on looking on the data of the healthy patients, on providing some kind of writing some recommendations for the wellness and so on. As much as we can do it with AI, the better outcomes we will have. Then we will free up the time for the doctors to take care of the patients with the acute symptoms. That's the one. And the second, of course, we will encourage a healthy patient to be in the constant touch with your medical organization or with the doctor through the AI, through the application that is available 24/7. So at the end, if you think about embracing AI for the healthy patient trend in your organization, then there is like 5 more steps that you need to go through. First of all, you need to define your vision for the healthy patient. You need to understand the real request of the healthy patients in your medical organization, because it depends. And usually, if you working in the big city clinic that you might have more requests for the preventive care. So you need to assess this. You need to understand what are the possibility and what is your vision. So what is your specific goals? How you want to go with this? Either you want to improve prevention rates because you don't have enough the free beds in your clinics and you want to prevent acute case, or you want to improve the chronic disease management if you have the patients already with the diagnosis but currently have no symptoms, how you want to go maybe with them, or you want to enhance the patient engagement if you're looking to expand the network of your patients and you want to develop the brand as the very innovative medical organization here. So really to understand why you need AI and what are the goals that you're pursuing with that. Then, of course, the next step, which is very important for any kind of AI innovation in the healthcare, not only for the healthy patient, is to assess your current infrastructure and data readiness. We will make additional event for this, but the situation is that before you will go with AI, you need to understand if your data architecture, if the data formats that you have, if the system that you have, they're ready for AI, if you have enough data, if you can build a stream of the data, and more important, if you have the healthy patients, how you will communicate with the healthy patients. So either you have already maybe some kind of the mobile application or you have any kind of the platform. Either you want to implement AI there or you want to build everything from the scratch. And this assessment is very important before you will go further on, before you will even start the phase of the ideation. Because if your data infrastructure is not ready, you cannot go for AI. Instead of investing money and time there, just invest this money and take care of your infrastructure and think critically how you can go with that. But if your data infrastructure is ready, then of course, the best thing that you can do after that is to identify potential AI use case and align with your goals. And here the goals should be very strict and very business related because we need to understand what will be the return on investment in this AI tool. We need to be very pragmatic. The reality is that the return on the investment in this area will be particularly after the third year. So you need to understand, in this case, your investment, your expectation from this investment. You need to understand the team that you need to build for that, and you need to align it with your transformational goals or any kind of the economical goals that you have inside your company, inside your medical organization. Yep. So how you can measure that, how you can understand and maybe build some risk zones or the stop signals that will identify that this program, this AI tool is not effective. So you need to think about this. And then, of course, after that, you need to pilot and iterate with a focus on workflow integration. Here, usually the medical organization has have a few ways to go. Either you will develop everything in house, you will have your own AI system if you have enough money to invest in that, or you can take the available on the market AI solutions from the startups, for example, just implement them and just to test before you will invest in developing your own AI tool. But the most important in these two cases, you need to focus on the workflow integration. Yep, you need to test how exactly this tool can be used in the standard workflow for the doctors. And then, of course, if you don't have the workflow for the patient, you need to develop this workflow. And inside this workflow, you need to implement the AI tool also for the seamless and the most convenient and the easy to use integration. As soon as you have all of these and you have AI tool, you have tested, you have piloted it, you decided to go on the production and full rollout of the tool, then of course you need to invest in training and the change management. You need to understand that you'll start with a small group of the doctors who are usually the most innovative in your team. But then, as soon as you go for the rollout, you need to educate the rest of the team how to use this tool. If you're talking about the health patients, you might also need some time to invest in educating the patients how to use these tools. You need to educate them how to react on the signals that the system might make and how they should interact with this new AI tool that they will have. So if you have all of these steps going through, you understand why you need, you have made your homework and you're testing your infrastructure, then you understand your business goals, you have piloted, you have gone to the rollout. And as I said, usually after the third year, you will have the good return on the investment. And of course, because it's the trendy things, you for sure will have a lot of the interest from the patient side. That's all for today. Thank you, everyone who have been on this stream online, and for who will be looking the stream in the record. That was my pleasure to talk with you, to share the insights with you. If you have any questions, you see right now on the screen my profile. You can contact me, and I will be happy to answer your questions. If you have more practical questions, you can refer to me. And stay alert about the upcoming events. I hope that next time we will have better connection and we can make it within the event itself. Thank you, guys, and I wish you a good day.